activity and participation limitations. As you see, the motor development is often limited. The rolling, sitting, standing, and all these progressing skills that you get as a normal developing child are all developed a little slower than normal. And we have participation restrictions. It's more difficult to go on family vacations. They tend to not be able to be in regular school classrooms. They need more specialized ones. Normal playgrounds and Little League sports are often restricted for these children, mostly because of the lax joints and instability in the neck. And somersaults are also not recommended for this population because of the neck instability, and transportation can be an issue.
So moving on to diagnostics for Down syndrome. During pregnancy is usually the best time to catch it. And we talked about before how age can be considered a factor as more and more women are waiting to have children. As Tasha was saying earlier, the later you wait to have a child, the more it increases your risk to have a child with Down syndrome. Many women are not electing to have any testing done during pregnancy because there are some risks with spontaneous abortions with some of the testing procedures, as you'll see later on. I think the easiest one to use is ultrasound, where they just, like a basic diagnostic ultrasound, they'll check the region on the baby's neck, and they'll look at see if any abnormalities are present, and as the more fluid usually collects in this tissue. Some blood tests that they can do, if they see that there are some abnormalities with the ultrasound, they can do different blood tests and look at different pregnancies and different hormones, as you can see listed here. And they can also do an amniocentesis, which is what they do is they just take a sample of the amniotic fluid and look for discrepancies or chromosomal abnormalities. And there's also chorionic villus sampling, which is where they take part of the placenta and look at, see if they see any oddities or discrepancies. The problem with that is most women don't want to have this done because there's a, I won't say high risk, but it's 1 in 100, so I guess it is pretty high, risk of miscarriage. And with the other one is percutaneous umbilical blood sampling, which is they just take blood from the umbilical cord and look for chromosomal defects. And with a lot of these, like with the chorionic villus sampling, you have to wait between certain weeks to do it, and with this we have to wait at least until after 18 weeks of pregnancy. They don't do any diagnostics during pregnancy. After they're born, there's usually classic telltale signs of Down syndrome, as Don was mentioning before. And they'll also do like a karyotyping, which is where they take a look at their genetic material and see if they do have a third chromosome, number 21. Medical management of Down syndrome, because there are some complications along with Down syndrome. They have many doctors who they might see. They'll see pediatrician for nutritional and just general information. Because people with Down syndrome are more at risk for cardiac problems, they'll probably see a cardiologist too. And they'll probably also have some hormone problems, so they'll go see an endocrinologist. And most people with Down syndrome have problems with hearing and seeing, so they'll go to an audiologist, and optometrist and an ophthalmologist, just like anyone would do with hearing and seeing problems.
So at this point, there's no medicine that will cure this disorder, so no one pill you can take to get better. Medications are used, though, to treat the primary and secondary impairments associated with development throughout the lifespan. Here are some of the impairments listed here in clinical prevalence according to one study. The endocrine system, like Patrick was saying, thyroid disease, so hormonal issues, diabetes, mental health, depression, and OCDs. abuse, physical or sexual conduct disorder, aka misbehaving. Otolaryngology, so sleep apnea, hearing loss, musculoskeletal impairments, spinal cord compression, atlantoaxial subluxation, as Nathan described. Periodontal disease, Alzheimer's, greater than 40% above normal. Cataracts and refractive errors, so vision issues. Seizures, testicular cancer is a little higher, 2 and Downs syndromes, and heart issues, specifically the mitral valve prolapse and valvular regurgitation. So on that, in that vein, the congenital heart disease, approximately 50% of children with Down syndrome have congenital heart disease, and subsequent early onset of pulmonary hypertension, so high blood pressure in the lungs. If heart defects have been identified before the onset, they have much more favorable results after surgery. Common congenital heart problems, tetralogy of Fallot, persistus ductus arteriosus, atrial septal defect, and ventral septal defects. Cataracts, approximately 30% of children with Down syndrome develop cataracts, and they can be dealt with surgically if necessary. So as far as PT is concerned, identifying and addressing primary impairments that limit function. So as well as preventing secondary impairments that limit function. Here's just a list of some secondary impairments, doesn't include them all. Hypotonia, so we would deal with the range of motion issues starting at a very young age. Congenital deformities, which impede development, and at this point, it just depends on how they are impeding. You would consider some sort of compensation or not, and that would be up to the PT and probably just the whole team of healthcare professionals. And then also cardiovascular degradation. This is the rate limiter throughout the lifespan. So as far as living a sedentary lifestyle is something that's pretty prevalent with these guys. And so rehab, as far as PT is concerned, maintain optimal, like I said, active range of motion, passive range of motion. Probably want to introduce strengthening and stretching program at a suitable age when they can do it voluntarily. When they can't, this is where a PT would be just working with a young child with Downs, just to bring through range of motion and encourage the use of their body correctly. Encourage family to assist in therapy and stress the importance of continuing therapy at home. And last but certainly not least, drum roll, please. Always encourage participation and move to learn to move. Courtesy of Dr. Cindy Dodds. Here too, if you want to get more information, also see video, here's 2 YouTube links that you can go and check them out on the web. Thank you. Do you have any questions? No? Okay. Thank you.
Top right.
I do it.